All right, let's move on to case number 7, iron Tike. And it's submitted by Johnny Lowe, a pediatric emergency medicine fellow from Michigan in Ann Arbor. Elaine Pomeranz and Athina Sikavitsas helped submit this case. And it's a fully immunized, healthy 7-year-old girl who presents with a progressive, painful rash that has worsened over the past 4 weeks. A few days before the rash, the patient's mother tested positive for COVID-19. She subsequently tested positive as well, and they were gleefully quarantining as a family. During their quarantine period, the rash initially started as subtle red lesions on her back, thought to be due to scratches from her toddler brother, who was also going bonkers in quarantine. However, the rash did progress, and at the end of their quarantine, they were seen by their primary doctor, who started a course of prednisone and amoxicillin. The rash worsened despite these highly effective treatments, and at an urgent care, they were told they had pityriasis rosea. And then they saw a general dermatologist who recommended a biopsy following the prednisone course that their PMD had already started. Frustrated by the lack of resolution and worried by the progression, the family sought care at the ED. All along the way, she has had no fevers, but she did have chills and fatigue as well as intermittent mild abdominal pain with this rash. The diffuse annular erythematous and pustular rash was tender to the touch, and it spared the palms and the mucosae. Here's a shot of her torso and upper legs. And here's a closer view of her legs and her back. Through the magic of digital technology, the patient's mother was able to share photographs of these lesions at various stages. So what you see here is day 3, day 13, and day 16. And day 23, 25, and today, day 26. So what is the diagnosis? Is this A, acute generalized exanthematous pustulosis, B, generalized pustular psoriasis, C, IgA pemphigus, D, laterothoracic exanthem, or E, staph scalded skin syndrome? 30 seconds. The correct answer is B, generalized pustular psoriasis. Derm was consulted, and the history and a later skin biopsy confirmed the diagnosis. And this case was suspected to be secondary to COVID-19, even though the patient was initially thought to be symptomatic. Mom had it, so they presumed she had it. There have been many cases of psoriasis exacerbation in the setting of COVID-19 infection, and a case of new onset generalized pustular psoriasis has been published as well. Acute generalized exanthematous pustulosis follows a drug exposure and has fever, facial swelling, and neutrophilia, so not exactly this kid. IgA pemphigus is an autoimmune blistering disorder, and it's associated with other autoimmune diseases like inflammatory bowel disease and rheumatoid arthritis, and it's seen in individuals 50 years of age or older. This is PEMPix, not MPix. Unilateral laterothoracic exanthema presents in infants and can follow viral infections, just like this one, but it's just usually unilateral, mildly pruritic eczematous or morbilliform rashes in the large flexural areas. And staph scalded skin syndrome is seen in kids under the age of 5 or 6. This is a fast-developing rash. The skin is denuded and is caused by exotoxin-producing strains of Staphylococcus species. Unfortunately, this patient had still been experiencing symptoms at the time of this presentation months later, despite corticosteroid therapy. She was started on orocyclosporin therapy and admitted for modified Gockerman therapy, which is application of UVB light and crude coal tar. Yeah, right. She will likely require biologics such as icatibimab and adalimumab in the future. I'm glad I got those ones right. And I don't need to remind you, but COVID-19 sucks, and vaccines don't.